everyone, my name is Dr. Amber and I'm one of the nurse educators at bootcamp.com. If you're studying for NCLEX, I have a delegation practice question for you. I guarantee you that you're going to see delegation and assignment making questions when you sit to take the NCLEX because they are very common topics on the exam. So let's briefly look at a question together. The charge nurse is supervising administration of a blood transfusion to a client with a gastrointestinal bleed by a registered nurse who is assisted by a licensed practical nurse, or LPN, and an unlicensed assistive personnel, or UAP. The charge nurse should intervene if the RN. So this question is basically asking us to identify an example of inappropriate delegation. Because remember, as a charge nurse, we're only typically intervening if something is inappropriate or unsafe for a client. So before we look at the options, let's briefly talk about one of the most important rules of delegation. And that is we should never delegate a task that is going to require nursing judgment or clinical reasoning. We also always want to make sure that that client is stable. So let's look at our options. Asks the LPN to report the color of the client's next bowel movement. So having the LPN report to the RN what color the client's bowel movement is a very routine task and the client is stable. So this is an appropriate task to delegate and does not require charge nurse intervention. The next option asks the LPN to draw blood for a repeat hemoglobin level after the transfusion. So drawing blood on a client that is stable is a routine task with an expected outcome and is once again appropriate for an LPN to do. The third option, ask the UAP to measure the vital signs before beginning the transfusion. So that's really our key word there is before. So this client should be stable because there's no risk related to a transfusion yet because we haven't began the transfusion. So asking a UAP to measure vital signs on a stable client is an appropriate delegation task and should not require charge nurse intervention. And the fourth and final option, asks the UAP to sit with the client during the first 15 minutes of the transfusion. So we know that if a transfusion reaction is going to occur, it's typically within the first 15 minutes of the transfusion. And that is when that registered nurse should be at that client's bedside, frequently assessing them. So that would not be appropriate to delegate to a UAP. Let's check our answer. And we're correct. So if this practice helped you, please join us for our upcoming webinar scheduled for this week on assignment making and delegation. We're going to do a couple more practice questions and share some additional tips and tricks on how to help you successfully navigate this topic on NCLEX. Hope to see you there.